Hello, hello. So, I think today is yet another day to have the conversation about representation in healthcare. Pardon my broken voice. Um, it's easy to say, oh, well, since this is maybe a problem of representation of a minority, why can't people stay in their home countries? Why do you have to travel? Before I did this voice over, I had to do a little research. Migration is as old as man, and people migrate for very, very many different reasons, from wanting to have better economic status to so many other reasons, life-threatening situations, even natural disaster. And from what I see, migration will not end anytime soon, because the factors that actually influence it is on the rise. So uh, research, if you do a little bit of research, you will see that for the next couple of years or hundreds of years, migration is going to be on the high side. So why not we begin to think about this in the very different areas of life. For me, because my background is in health, and of course now we know about the social determinants of health, it's important to have these kind of conversations. And for me, I think that the most important thing is that not only the healthcare practitioners but the health policy makers and just policymakers in general need to put into consideration the fact that we are accommodating people who are different from us. Mind you, healthcare is a human right. We are accommodating people who are different from us. So why don't we put in the extra effort, on how to ensure that our healthcare system or other areas of our lives are conducive for them, you know. And it's interesting because I'm putting my personal experiences aside at the moment. I'm just going to share on what I've heard people share with me. So I just spoke about the topic of migration. How about, of course, we know how migration works. Migration now is leading to a lot of interracial marriages, which also have disadvantages and advantages. And it's important because in my previous video about this conversation on representation in healthcare, I cited the example of, knowing our genotypes and sickle cell disease, because we know that Black people are more predisposed to this disease. But now, research has shown that we're having more people who are not Black, who are who are now becoming anemic or will now have sickle cell, because and one of the factors, not just sickle cell or other diseases, one of the factors is because of interracial marriages, that eventually produce interracial children. So it's really important that we need to take this into consideration. I think it would be impossible, because the world now, it's a global village. It would be impossible to burden people in medical schools to say, oh, you have to know how the disease that affects every race. That I am a trained pharmacist myself, and I know that could really be burdensome. But I think just having that awareness that people are different, and then maybe put this into consideration, will make a whole lot of difference, because that will also inform the decision of healthcare practitioners to say, okay, well, I know how this disease appears in people that look like me, but saying that, what's your background, where are you from, where are your ancestors from? Maybe because if this treatment is not working for you, maybe it's because of this. Can you give me some time to research, or let me get back to you? I think that alone, will result in a lot of better, much better health outcomes. I'm going to cite an example of a friend. He's a personal friend. I would mention names. He's originally Nigerian. I mean, his parents are Nigerian, but he was born in Europe, and then now he married like a proper European, and now his children are interracial. Now his children come down with infections, skin infections, or other kinds of infections, and then the doctors don't know what to do. He has shared this with me, like he's complained about this to me a couple of times, and then the doctors don't know what to do. They call it this, and then they give the medication for which they think but it's not working for them. So just having that mind, and it's possible that if the healthcare practitioners can just pause a little bit to say, okay, oh, this might be the reason. Okay, maybe why not try this? And it's surprising because once they get it right, it's really simple things, and probably it can save them a lot of costs by just knowing that, oh no, this is even way too much. You just needs just this other medication and not this one. So it's very important. I also have a friend who lives in Europe. She's a nurse. She's from Sudan. I think South Sudan, but she lives abroad now, and she's given this kind of examples to that people come down with infections, and then especially skin infections, and the doctor says, well, I know how this looks on white skin, but a skin that has more melanin. I don't know how this works. So I believe that just having the consciousness that yes, people are different, and just putting that into perspective will go a very, very long way. So what are your thoughts? Let me know what your thoughts are. Please drop in the comment section. And like I said, don't mind my broken voice.